Okay, good morning, everyone. It's a couple of minutes after 9 o'clock, so I believe we can go ahead and get started. Thank you very much for joining our PathWays stakeholder update this morning. My name is Cora Steinmetz, and I'm the Director of the Office of Medicaid Policy and Planning. And I apologize, we've learned that due to a systems issue, we're not able to turn on our cameras today. So sorry for being off camera, but luckily we have some robust information on the slides that you would rather be paying attention to anyway. So again, thanks so much. We're really excited to share some updates now that we are about 75 days into the program. If we could go to the next slide, please. So as I believe many know, the Pathways for Aging program did launch on July 1st, 2024. So Pathways joined 3 other managed care programs within the Indiana Medicaid delivery system. And this is, as you know, the long-term services and supports service delivery for our Medicaid beneficiaries who are 60 or older and eligible for Medicaid on the basis of age, blindness, or disability. I know this is review information for many of you, but if this is your first time engaging with us or learning about the Pathways program, we do have 3 managed care entities who are working with the state to deliver the Pathways program, and that is Anthem, Humana, and United Healthcare. Many of the individuals who are receiving coverage through the Pathways program are receiving also home and community-based services benefits, or maybe receiving services in nursing facilities. The last time we spoke with you was right before our program launch, so we're very excited to share updates now that we have real experience in the program. As of September 1st, we had 116,000 individuals enrolled in the Pathways program, 44,000 of whom are with the Anthem program, 35,000 or so with Humana, and 36,000 with United Healthcare. One thing I also want to mention at the outset is that about a third of our individuals on the program are part of the Pathways waiver program. One common misconception is that the Pathways program itself is the waiver program, but really it's embedded within the broader Pathways health coverage program. So not all of our Pathways members are receiving home and community-based services waiver services, although a portion of them certainly are. So I'm going to turn it over now to the Director of Care Programs for the Office of Medicaid Policy and Planning, Holly Cunningham-Piggott, who will walk through a number of key updates, share some data, and then I'll be back at the end to share a few other thoughts. So we could go to the next slide and turn it to Holly.
Good morning. I just want to make sure everyone can hear me.
Sounds great.
Okay, thanks, Cora. Good morning. Thank you for joining this update. We did officially launch July 1st, and then as new individuals age into Pathways, we've added new membership in August and in September and then so forth. So it'll continue that way as people come into Pathways because they have turned from 59 to 60, or they're newly eligible for Medicaid. When someone becomes eligible for Medicaid and eligible for the Pathways program, they get a notice that tells them that they need to select an MCE. Then they have a time frame. Generally, it's about by the 60-day mark prior to their transition into Pathways. If they have not picked an MCE, then the state will assign an MCE using an algorithm within the state. And they will auto-assign them to an MCE at that point. The member, though, can continue to make changes to their MCE all the way until go live, which is always going to be the first of the month, unless there's some rare circumstance that someone comes in outside the first of the month. Most people will come into Pathways on the first of every month. And then they can continue to make a change to their MCE from that enrollment date, so that first of the month, for the next 90 days. They can also change their MCE once a calendar year. So that one time is during their redetermination. They usually get like the month before and the month of their redetermination date to make changes to their MCE. Because 80% of the Pathways population is also receiving Medicare benefits, they can change their MCE during the open enrollment period, annual enrollment period for Medicare. So that's usually mid-October to the beginning of December. They can also change, because so many folks are all, again, on Medicare. If they sign up with a D-SNP with United, but are getting their Medicaid with Anthem at that time, then they can switch MCEs so that United could do the Medicaid and the Medicare, which we call aligned. That would be an aligned plan for that person. So they can switch during that time. And then members can always change their MCE for just cause. So, if they're truly unhappy at their MCE, maybe their provider is no longer in the MCE's network, that would be just cause that they can ask to be switched to a MCE where their provider is in the network. Or if there's any kind of significant quality issue that has been substantiated, they can change at that time too. And to make those changes and to, for the initial enrollment periods, they just have to call the enrollment broker, and we've put the phone number here on the slide. And they're open 8 to 7 Monday through Friday. Next slide, please. So as part of our contracting process, we wrote and put in to our request to CMS for when we started the PathWays program, that we were going to have a third party neutral call center group that would not be tied to the MCEs. So we have contracted with Maximus, and we have what we're calling the member support services line. And that is it's an opportunity. If a member is not comfortable talking to the MCE, they can call this, third party neutral support. And we call it MSS for short. The MSS team can work with that member to help them advocate for what they want. They will call the MCE with them. If they want to file a grievance, they will work with them to file a grievance with the MCE. If they just don't even understand, the MCE send out all kinds of information, and it doesn't make sense to everybody. So they can call the MSS to have them help them kind of understand the materials, or get them connected to somebody at the MCE who can help explain the materials. And so it's really just another support piece. And I almost consider it another way we're monitoring the MCEs as well, because the MSS, when they call the MCEs, they have very specific questions. And if those questions can't be answered, then that tells us we need to go back to the MCE and address maybe retraining with their employees. They sometimes when they file a grievance, maybe the letter doesn't come back in the favor of the member, but it truly should. So they've been able to come to my team and say, we really think something's not right here. Can you help us with this MCE? So I really am treating the MSS not only as this third party neutral call center that advocates and can help our members, but I also am considering it another kind of monitoring and oversight that we are getting feedback from regarding how the MCEs are doing. And members can call MSS, and all of this information is on our website as well, but the phone number is there at the bottom of the slide, along with, they can also send them an email. They don't have to call, they can send an email, and Maximus will return either an email or return a call very promptly. And their hours are 8 to 8, Monday through Friday. Next slide. The top call reasons that we saw in the first 60 days of the MSS were that folks didn't understand, either they had questions about care and service coordination, or they didn't know who to contact for their care and service coordination. And so what MSS did then is they would call Anthem, or they'd call United, or they'd call Humana with the member on the phone and help navigate that information. And, and then again, early days, we were seeing that our call center reps with the 3 MCEs were having a difficult time finding out who was assigned to what new member. And so we were able to go back to the MCEs and say, hey, there's something not connecting because people aren't able, when they call, they're not able to tell them who their care coordination and service coordinators are. It was also folks that were getting like maybe DME regularly delivered or meals through the waiver or transportation questions. That was really we had a high volume of callers that requested or needed assistance with those things. We had a lot of folks calling because their home health providers maybe were nervous about providing care because they weren't sure how the continuity of care worked. And so we had folks calling us about that. And we were able to get with the MCEs and get that person connected with an MCE so that they can make sure that their prior authorization is still in place from the transition from fee-for-service to managed care. And then we have pharmacy inquiries, pharmacy calls about, and again, 80% of the Pathways population is Medicare, but they wanted to make, lots of people wanted to make sure there wouldn't be a disruption in them getting their medications, and that it doesn't impact, this change doesn't impact their Medicare benefits and so forth. If there is an issue that comes across that is, urgent, egregious, something needs to be done immediately, we do have an escalation process with the MCEs. So the MSS has a contact person at each of the MCEs that they escalate so that this can be known as urgent, and we need someone to quickly get with this member and follow up. And then most escalations we've seen now are resolved within 2 to 3 days. This process, we continue to have touch points between the MSS vendor and the MCEs. They meet every other week, and they talk about, things that are working, things that aren't working. And, now that we're almost to the end of 90 days, I would say that they've really gotten into a good groove of working with each other. Next slide, please. I was talking about just a minute ago about monitoring and oversight. And so when Pathways went live, before it went live, the year before it went live, we did a very robust readiness review process. And it was, we had to ensure that the MCEs were ready to take enrollment July 1st. So they had to show us their systems. They had to show us their policies and procedures. And it's a very good, it's a really nice way to get a look inside how the MCE works. And so we don't want to stop that momentum of, doing these kind of checks and audits. And so we are going to continue what I would call a post-readiness process. That probably is very oxymoron there, but the post monitoring that we plan to do will look much like we did with readiness. We will give the MCEs a list of things that we want to see. When we did readiness, they had to demonstrate their systems, but their systems were not live yet. So we were seeing like their test environments because they didn't have any members yet. And so now when we're doing this post monitoring, we're actually asking to see their systems in real live time, so that we can make sure that what they showed us in the test environment is also how it's working in the live environment. And so we're doing monthly on-site audits where we go and we ask them to demonstrate different systems. And then we are doing also some desk reviews so we can see process flows and policies and procedures and some reporting. And I'll get into a little bit more about reporting in a second. But the other thing we really wanted to make sure we were doing is, we understand that information has to come, we're giving information to the directors of Pathways at each of the MCEs. And we wanted to ensure that there was a trickle down of this information to the folks in the field. So we've done secret shopper calls with the MCEs. We do website spot checks. We have been doing them website spot checks, or the provider kind of locate provider tools that they have on their websites. We go out and randomly we'll put in a provider that, to see if it's searching correctly. We also are doing so that we can kind of be in the weeds with the MCEs. We've done some call where we've gone into their call centers or had them bring their call center staff into their office so that we can listen to them, take calls for a couple hours, and make sure that they understand and are relaying the PathWays message correctly. And then we're actually getting ready to do some, I'm calling them service and care coordination ride-alongs. We're not necessarily getting in the car with them, but we're going to be going into the field with the service and care coordinators when they go to visit members so that we can, again, it's really kind of that check and balance. We need to make sure that the MCEs are delivering this program in the manner that we expect and how it's written in the scope of work. So we've got some checks and balances, and some of these things we found too that we may want to carry these over into our other Medicaid programs like HIP and Hoosier Care Connect and Hoosier HealthWise. So I think that through this process, we've definitely been able to identify some best practices that we really need to do across the board. I think we can go to the next slide. So this slide is really more of a visual, but I wanted to just kind of call out how we're continuing to manage and monitor the PathWays MCEs. And so part of our go live process was that they had to submit weekly reports. It's not normal for us to ask for weekly reports in the normal kind of working environment from the MCEs. They generally have to submit some reports monthly, some quarterly, some annually. But for go live, we had some things that we wanted to monitor weekly, and that includes like claims production, our claims paying, our claims being denied. Are they adjudicating timely? And so we have a claims processing report that the MCEs are submitting to us weekly. We get these reports every Monday. We get to review them like on Tuesday, and then I have a daily call with the MCEs. And so we review then anything on the report that seemed a little out of the ordinary. We bring up on our calls, our daily calls with the MCEs. They're submitting the MCE call center. So we're getting the volume of calls, which I'm going to show you here in a second, but the volume of calls every week are those, I'm sorry, I've got a frog in my throat. Are those calls being answered timely? Are people on hold so long that they abandon and hang up? And so we track all of that, and that's for provider and member. And I'll show you some of those, that data here in a second. And we track prior authorization denials. We're also right now tracking. They have to do assessments with most of most of this new enrollment, and so we're tracking how many of those things that they are doing. And so, and then they have their regular monthly reports that we just got. We already reviewed July, and we will be getting August here in the next couple of days, and so forth. So we're continuously looking at this data that the MCEs are sending over. And then I talked about the on-site desk review audit. So this post-go live monitoring, I kind of went into a lot of detail about that in a previous slide, so I'm not going to go too deep into this. But again, it's this ongoing monitoring and auditing, and how do we get ourselves in the position with the MCEs to make sure that they're giving the right information to those members. And then we have continued MCE interaction and oversight. So we are having like I said, the daily stand-up meetings with the MCEs. We have weekly clinical meetings with the MCEs and provider meetings with the MCEs. We also have weekly quality meetings with the MCEs. And so, this is really so that we can keep our finger on the pulse of how things are going. And then we continue to interact with stakeholders and solicit feedback, because we don't know what we don't know. And if we're not hearing from stakeholders, our provider associations, members, then we're not, if we don't hear from them, we don't know really what's not working and what is working. So that's how we, this little chart here is kind of how we are doing this ongoing monitoring and oversight of the MCEs. Next slide. So this is the member call center data. This is July 1st through August 31st, so the first 2 months of the program. You can see that Anthem, Humana, and UHC, this is the total number of calls they've received. They're required to answer the call live within 30 seconds, and they have to meet an 85% or higher metric on that. And they are meeting that metric as of today. So this is through the last 2 months. They have been meeting this metric. Then they have to also report out the number of abandoned calls, and they have to have a less than 5% abandonment, and they all are well below 5% on that. And then they also have to be able to accept after hours calls and have a voicemail where folks can leave a message after hours. And they all have been meeting that target in the process of returning the call promptly. Next slide. And then this is the provider helpline. There's been less providers calling than members, but that's to be expected. But you can see Anthem, Humana, and United as well. They're meeting their metrics for this. These are the same metrics that the member call center has. What we're seeing and what I have been seeing is that they're, when I review their reporting, is they continue to meet these metrics. And we have no concerns right now with the call center data. Next slide. So that kind of goes into our next, as I was talking about, the monitoring and oversight. Us really making sure too, like our number one concern, not our number one concern, the member was our number one concern, but our second concern was making sure providers are able to be paid when PathWays goes live. So we have through a Senate bill last year that passed, or earlier this year, I guess I should say, we were required to put together a claims advisory work group. And we put this work group together, and we started off meeting weekly starting in April. And now we're meeting every other week. But this advisory work group consists of several different provider types, and they can report back to us what they're hearing from the other members in the associations that they are members of, or other, just peer providers that they may talk to as well. And so they can bring those issues back. And so we were able to identify some things prior to go live, but we were also, since go live, also this group has brought us several issues that we've identified after go live. And so the MCEs have been very quick to pivot when we identify a claims processing issue. So like, for example, it's on the UB04, we need to make sure that the right bill type was on there. Well, Gainwell required one bill type, but the MCEs required a different bill type. So we had to figure out how to get those things aligned so that the MCEs all required the same bill type for the same types of stays, and get that information out to providers. We also realized that so for waiver, you have to bill with your LPI, if you have an MPI, not using the NPI, because that will deny claims. But through the process, we found out that Gainwell accepts an NPI for waiver claims because they do kind of a crosswalk behind the scenes to match it with the LPI. Well, we didn't know this information at first, and the MCEs did not have this crosswalk built behind the scenes. And so at this point, all of the MCEs are now paying whether you submit a claim with the NPI or the LPI for waiver. They're doing a crosswalk behind the scenes to make sure, because we were having high denial rates for this specific reason. And then there were certain services that where they were requesting a COB, which is the coordination of benefits, because they were a dual, and I had Medicare, and this is something that probably should go through Medicare before it comes to Medicaid. And so there was lots of things that kind of bubbled to the top after go live that we had to quickly pivot and remove that requirement for certain services that, sometimes Indiana is unique. These MCEs do LTSS services in other states. Sometimes Indiana is unique in some of our billing processes. So that we had to get with the MCEs very quickly so that they could reconfigure their systems to not deny those claims. We saw, I just did a review of the claims yesterday, and I think there might be a slide in here that I can talk through, but we saw a drastic decline, increase in, we saw a decline in denied claims and saw an increase in paid claims over the last probably not 3 weeks, but over the last 4 to 6 weeks. And so we are continuing to monitor this data and information. If an MCE pays, so there's the requirement is that claims for most services need to be paid or denied within 21 business days, or 21 calendar days. And if it's waiver, it should be paid or denied within 7 business days. If they pay outside those, if they don't pay or render a decision in that time frame, then the MCE has to pay that provider interest for every day that they go unpaid or that they have not received a decision on their claim. And so one of the things that we're monitoring is that the MCEs are paying that interest, because we know that they've paid adjudicated claims outside of those timeframes. And we're seeing that they are correctly assessing interest, and they have been paying interest on claims that were paid outside of those timely requirements. We are, I feel we're in a good place with the nursing facility claims at this point, and we've been really heavily focused on the waiver claims, making sure waiver claims are getting paid. We're working heavily with the different associations to get feedback and address issues. And there's been many claims through the waiver that were maybe initially denied that we've gotten fixed, and now the MCEs are reprocessing. So when I looked at the claims report, it appears that that they're reprocessing a high number of claims, because every week is a high number of paid claims on their reports. Do we want to go to the next slide? Okay. Do you want me to talk about this?
I'm happy to pop on here for a minute, Holly.
Okay. Sure.
So temporary emergency financial assistance program, as Holly mentioned, with the legislation that was passed in the last session, in addition to sort of a claims work group and some claims testing that we did before go live, there also is an opportunity for those providers who participated in claims testing to apply for emergency financial assistance if they experience what the legislation defines as a financial emergency. This is specific only to the PathWays program, not to other areas of Medicaid. And again, is for providers who successfully did claims testing, which we did have around 2,500 providers who successfully went through that process from April through June. And that was a great process, which really helped us detect issues in advance of go live and help the MCEs with system configuration needs. So we've received a couple hundred, I would say, temporary emergency financial assistance applications. The great thing about this is, even if an individual or a provider applies and they didn't complete the claims testing, if they're experiencing some sort of challenge with claims submission, the MCEs on a daily basis are doing direct one-on-one outreach to providers to help them resolve their issues. So in many cases, even if a provider did not successfully test, or they don't meet the definition from a statutory standpoint about a financial emergency, it flags for us, the state, as well as the MCE, that, hey, this provider needs some one-on-one help. So we have a team that on a daily basis is reviewing these applications and sending over each night to the MCEs a list of the providers that need some assistance. And then, of course, we have granted a number of emergency financial assistance applications. One note around the emergency financial assistance program is that it is an advance against future claims that would be submitted to that MCE by the provider. So it's not a grant. It is an advance, and an AR is put on that provider's account with that MCE to reconcile future claims once 30 days has passed after sort of the time at which we've granted the emergency financial assistance. So overall, this program has been a really helpful tool, both to ensure that providers that are experiencing cash flow problems are able to have relief, as well as continue, as Holly said, our issue spotting and escalation process. We can go to the next slide, and I'll pass it back to Holly to talk about open enrollment.
And just to add on to what Cora said, outside of the temporary emergency financial assistance, because providers do have to participate in the testing, that doesn't mean providers should not tell us if they're having claims payment issues. We definitely need to know so we can get connected with the MCEs. The MCEs are very flexible and have been assisting providers who maybe have issues, claims issues with, getting payment quickly. So please don't hesitate if you're in a situation or you hear of a provider or you are a provider, please let us know so that we can help you get connected with the MCE. And they can again, they're very flexible. So the next thing, I talked about this a couple different times now, but 80% of the population that is with PathWays is also a dual and receives either some sort of Medicare through a D-SNP or a Medicare Advantage plan or through the Medicare fee-for-service. But the open enrollment for Medicare is coming up, and just so to throw this out there too, the open enrollment for HIP is also coming up too. So if you have anybody that's on HIP, it's also coming up as well. But this runs from October 15th to December 7th. And this aligns with the Medicare open enrollment. So we talked on the previous slide that this is one of the times that our PathWays members can make a change in their MCE. I'm sorry, I'm stuttering over my words. A letter will be sent to the member informing them that they can make this change. And they would just need to call the enrollment broker to let them know that they want to make this change. So if you have individuals that you serve or you are an advocate for individuals, and they get this letter and they say to you, what the heck is going on? Just a heads up that there will be some communication going out. Those letters should be going out between September 18th and October 1st. Members should start seeing those letters going out in the next, or arriving in their mailboxes in the next couple of weeks. If they miss that open enrollment, then I went over the other times that they can change. They have several other opportunities during the year that they can switch their MCE. Next slide. And this is just an example of the open enrollment letter that will be sent. It's pretty similar to the letters that folks received when we went live with PathWays, or it's very similar to the letters that folks continue to receive as they age into PathWays or they become eligible for PathWays. Next slide. And so these next couple of slides are just to point out resources. So the MCEs, they have very dedicated provider resources specific to PathWays. And so we've put their contact information, and then we've put links for their manuals that you can go out if you need or have questions for the provider side. These are the provider manuals. We've put in our PathWays general email box. You can send this. I have staff that monitor this mailbox all day long. We respond immediately, letting you know we got the email, but then we also try to get a response out in the next 3 to 5 business days. So if you have a question, you can send something to the Indiana Pathways at fssa.in.gov. Next slide. This next slide is really member resources. Again, it gives all of the MCE contact information, and it gives links to all of the member websites. And again, you can send emails to that Indiana Pathways mailbox as well. What we do is if someone's having a hard time getting connected with the MCE, they don't know how to do it or they don't understand, then we get them connected with someone who can at that MCE that can work with them. Okay, next slide. And this is just some information on our website. We have lots of FAQs on our Pathways website, and we have lots of other information out there. So here we provided some of those links on this slide. And I'm going to turn this back to Cora. And if you need anything, please reach out to us. We are happy to help.
Thank you so much, Holly. Just a couple closing remarks. Thank you so much for joining us today. We really appreciate the level of engagement. I just want to highlight a few things in summary or highlight a couple areas because I know we went through quite a bit of information today. So if you are experiencing issues on the member front, that member support services is really a great place to go because, again, we have OMPP resources monitoring that on a constant basis. I personally look through the call issues to have a sense of how things are going for our members because, as Holly mentioned, from the time of go live, our number one goal and the thing that we reiterated again and again with our managed care entities is to ensure that there was no disruption in service for our Medicaid members. If you are a provider or another stakeholder who is experiencing issues with a managed care entity or has questions about what to do, again, that provider relations contact for the specific MCE is a great starting point. But again, as Holly mentioned, we have dedicated resources here that are also monitoring specific issues, and you're welcome to reach out to that Pathways inbox. With that said, I would recommend as much specificity as you are able to provide us in sort of issue resolution, with a big asterisk caveat that, of course, please make sure that from a PHI HIPAA standpoint, that's not causing any concerns. If you have secure information that you need to share with us to help us resolve an issue, we're happy to help make sure you can do that via a secure email. But with that said, it is very challenging at times to track down issues that are sort of generic or anecdotal. So the more information you can share, be it at that member support services with the MCEs and their provider relations contacts or their sort of claim experts that people might be working with, or us as the state, that really allows us to dive in quickly and help resolve whatever may be out there, as well as provide education. And be it in a format like this or through provider bulletins, that's something you're going to continue to see us do. I'd be remiss if I didn't recognize the OMPP team and the Pathways team at large, again, in collaboration with the Division of Disability and Rehabilitative Services and the Division of Aging at FSSA, and the amount of work that our state staff has put in, because I have never seen us respond as quickly when issues come up as we have with this Pathways Go Live. So I'm very appreciative of that. And I'm especially appreciative of all of you as stakeholders from the time of the design of this Pathways program, stakeholder engagement and feedback from community members, individuals with lived experience, Medicaid members, providers, has just been an integral part of how the program was set up from the time of the launch of the RFP, as well as the 1-year readiness process leading up to it. And now that we're about 75 days post go live. So really appreciate the continued engagement and discussion that we're having with all of you as stakeholders. And I'm really excited to see where this program goes as we enter sort of this 90-day mark and stabilization of the launch of the program. So with that, thank you so much for joining us this morning. We hope you found this information helpful. It will be available on our stakeholder webpage if you need to share this webinar with colleagues or others who were not able to attend. And we look forward to talking with you all again soon. Thanks so much.